We're going to go live.
All right, are we live? Is that working, Gage?
Yep.
Okay, cool.
We're live.
So I'll start, and generally we've had, since the COVID crisis began about a month and a half ago, we've had a daily press conference where I give an update on what's going on in the city, and then I open it up to questions from the press. And one of the things that's been missing from the press conference is questions from other groups in the community. And we thought that it would be a great idea to get questions from young people in New Haven. In normal times, I'd be able to go to different schools around the city to physically interact with folks and hear from you all directly. But since that can't happen, we thought this would be a nice way to get an idea of what you guys are thinking and what questions are on your mind about COVID-19. And I think it's important to underscore that you all are representatives of so many more kids in the community. So in thinking through the questions that you might ask, ideally, it's not just questions that you have, but questions that you think other people might have that are your classmates or friends as well. So what I usually do is I start off with an update on how things are going in the city. And I will give that update right now. So we have a total of 1,619 cases that are confirmed positive COVID-19 cases in New Haven. It's actually a big jump from yesterday. And one of the reasons we think why it's a big jump from yesterday is that oftentimes we don't get the information right away. And so we'll get through the Department of Health a daily update, but sometimes we get 2 updates a day or 3 updates a day. Sometimes they come in later, sometimes they come in earlier. And we got a big jump this morning, but we didn't get a lot of updates yesterday. So we think that that the jump isn't necessarily an indication that there are even more cases. We've generally seen a slowdown of the number of cases over the past week or so of an increase every day. But nevertheless, we're keeping an eye on the 1,619 cases and that increase every day to make sure that we're doing everything we can to slow the spread of the virus. In addition, unfortunately, we have a total of 59 people who have passed away as a result of COVID-19. Most of those people are seniors. And as people know, a lot of the people that are passing away also have other health conditions as well. We're very sad that those individuals that are very much a part of our community no longer will be with us. We've spent a lot of time doing food distribution, because one of the things that is really difficult for people now is that a lot of people are out of jobs and don't have a lot of money to buy food. And so we've worked with many nonprofits around the city to do food pantry, support our food pantries, do mobile food pantry deliveries. And even yesterday, we provided food to 95 seniors. We did 95 meal drops, and each one of those meal drops had 5 meals in it. So we're trying to support our seniors, and we've got some more food distribution coming up this weekend. One other thing before I open up to questions is, as you may have heard, testing for the virus is a really important thing, right? And there's around the nation not been enough tests. And when you don't have enough tests, you can't figure out who has COVID-19 and who doesn't have COVID-19. And if you don't know who has COVID-19 and who doesn't, if someone has it but they don't know, they might not self-isolate, they might not go into their home and not interact with other people. And that would put them at risk of spreading the virus to other people. And so testing is really important to figure out who has it, so we can tell them, stay at home, don't interact with other people, because you might give it to someone else. Well, around the nation, we haven't had a lot of testing, but many communities like New Haven have been working hard to increase the number of tests that we're able to provide. And we have 5 testing sites in New Haven now, and 2 of them are closed today. And that's something important to share with the press, because we want to make sure the public knows that they're closed so they don't go to them today, because there's been a concern about some potential storms. And the testing sites, a number of them are outside, and so they have tents, and they might blow away, or they might be dangerous. And so we closed 2 of the sites today. One site is the CVS site, which is a big site that people drive through, and they're testing hundreds of people a day. And then the other site is a site that we started just yesterday, that's at the corner of Day Street and Chapel Street in Dwight, in the Dwight neighborhood. And they're fully outside. And so they closed today, and they're going to reopen tomorrow once we're expecting the weather to be better. So those are all the major updates I have for today. I was thinking for questions that maybe because there's a limited number of people on the call, that we could do one question each and just go around, and then go around again and do another question. Does that work for everyone? And I presume that you guys know how to unmute your mics. It took me a while to figure out, but I bet you figured it out on the first try. And I'm looking on my machine. I have Mike Martinez's kids as the first. Do you guys have a question that you want to ask?
Yes, we have two. So, first I want to thank you for keeping us safe. It must be like insane for you to become married only in January, only to face this pandemic. But my question is, if parents go back to work with social distancing measures in place, but schools can't open, how are kids going to homeschool if their parents are at work?
This is a great question. Can you say both of your names?
Ryan and Jaden Martinez. Yeah, I'm Jaden. He's Ryan.
So Jaden and Ryan Martinez. Gotcha. Thanks for asking the question. Actually, this is a really hard question that we're talking about in City Hall, and we just had a meeting, a Zoom meeting like this one, about an hour ago, with about 50 nonprofit leaders as well, because they're also trying to figure out, a lot of nonprofits in New Haven work with young people, and they're also trying to figure out what they want to do, because there's a lot of summer programs. There's like the Eli Whitney and Common Grounds and the Boys and Girls Club, all these different nonprofits, and they also are trying to figure out, do we offer summer programming? So we're having conversations inside of City Hall as well about whether we offer the Youth at Work program where we pay young people, or do we offer, the New Haven Parks Department has a lot of youth programs for the summer. And I don't really yet have a good answer for that. What we're trying to figure out is, as we open up, and we're going to start slowly opening up, how much can we go back to the programming that we used to do without jeopardizing the health and safety of people in the community. And so what we have done is we've decided to think about creative ways that we can offer activities for young people, where we might be able to keep them separate, keep them safe. In some cases, maybe even keep them at home doing some Zoom meetings, things like that. We're also exploring ways that young people can help volunteer for nonprofits for the summer. So for example, there's a lot of food distribution going on, and there's a lot of volunteers that they need. And so there may be ways that we can pay young people through the Youth at Work program to volunteer or to work at a nonprofit and help the nonprofit support people in the community. So this is a long way of saying we don't yet have a good answer for this, but we're working hard in City Hall to come up with a good answer, to make sure that we're providing some support for young people in the community. And you're right, if we do start opening up, parents are going to start having to go back to work, and they need some way to take care of their kids, right? I'm thinking about the same thing, and my wife is thinking about the same thing for my own kids. You said you had 2 questions. I think maybe we could do 2. We probably have enough time, and then we'll go and have 2 each.
It seems like we're not going back to school this year, but is there a plan that teachers, the city, and the Board of Education are now working on for September? If there is, what is it? And is there anything we should get prepared for?
You're asking the 2 questions I don't know the answer to yet, which is good. It's a sign of a good reporter when you stump the person that you're asking questions to. I think it's really unlikely that we're going to go back to school this year, this school year, right? So the governor has said that he's going to make a decision 2 weeks before May 20th. So he extended the school outage until May 20th, but he said he's going to make a decision pretty soon on whether to close schools for the rest of the year. And we're waiting for that. But I'm pretty sure he's going to close schools for the rest of the year. September's a long way away. I think unless something dramatically changes, it's pretty safe to say that we really want to open up schools again. We'll have to be really thoughtful on how to do it. And I think that in general, with opening up, we're going to have to think about our lifestyles in many different ways, about how to have social distancing, how to make sure that we have hand sanitizer and kids that are washing their hands, and lots of opportunities to do that in public schools, making sure that kids wear masks and everyone in the community wears masks so that we can keep each other safe. So we're going to be having, the nice thing is we have a lot of time before September, right? So we have a lot of time to plan and figure that out. I know that we really want to open up school in the fall, and we'll be working hard to do that. So let's go on to Eleanor Metz. Can you put yourself off of mute? Yeah, awesome.
How is the COVID shelter at Career High School going? Do you think that the fight was worth it? What have you learned from your experience?
So it's a good question. So let me give some background on that site for people that don't know about it. So Career High School is a site that we decided to use as a facility to make sure that people that are homeless are able, that test positive for COVID-19, are able to self-isolate. So a lot of people that are COVID positive, the hospital, they don't need to go to the hospital because they're not sick enough to go to the hospital. And so what many health professionals are advising them to do is to go home and self-isolate, stay alone at home so that they don't give the virus to other people. But for individuals experiencing homelessness, they don't have a home. And so they don't have a place where they can self-isolate. So it's really important for us to find a way to help support them and give them some resources in a place where they can self-isolate. And so we chose Career High School many, many, many years ago as the regional shelter where if there is an emergency, we'll use the high school as a place to open up for community support. And I think the site has been going really well. We have, on average, have around 5 people in the site. I'm grateful that we don't have many more than that. I think that's a good indication that we've worked really hard to reduce the spread of the virus. But there's been on average 5 people at that site. And if we didn't have the opportunity for people to go to that site, they might be forced to go to other places and potentially expose other individuals in the community. So I think it's really important that we have that site to make sure that we're keeping the individuals that are there safe with nursing staff to help support them if there's a problem, but also to help keep the community safe. Thanks for the question. Let's go, I'm just going down my list here. Isabel Faustino.
Hi,
How are you?
I'm good. How about you?
I'm all right, thanks.
All right. So one question that I've really been wondering is, especially in middle school, a lot of kids are like very, very bullied on how they look and stuff. And I was actually really wondering, what were some techniques that you and your family uses to stay fit during this quarantine?
Oh, that's a good question. So the question is, what techniques do my family and I use to stay fit during the quarantine? I still go running myself. I really like running. And as long as, I wear a face mask when I go out. And as long as I'm keeping a safe distance away from other people, it's okay to go running. I don't know if you saw, but we closed some roads in East Rock Park so that more people that were previously using the trails, and the trails are pretty narrow, so it forces people to be pretty close to each other, could instead walk on the road so they can practice social distancing and stay a little bit further away from each other. I know that my daughters and my wife like to play outside in the backyard, and that's been keeping them pretty active and busy. And I think I've heard of a lot of people doing push-ups at home and sit-ups and lots of other exercises to keep themselves fit and healthy. It's not just about making sure that we're physically healthy, but also exercising helps a lot with mental health. And so I think it's really important for people to try as much as they can to keep healthy, especially when you feel cooped up, and I think that can make people feel kind of down over time. I'll come back to you, Isabel, but there's a lot of people, so let's keep going. Let's go to Shima Ibrahim. How are you doing?
Good.
Good.
What have you had to put aside because of the effort needed to address COVID-19?
Can you say your name? Is that your name, or is that?
That's my mom's name.
Okay. What's your name?
Adam Dweck.
Hey, Adam. Can you say your question again for me?
What have you had to put aside because of the effort needed to address COVID-19?
Oh, this is a great question, because when I started, I've been mayor for, I guess, about 4 months now, which isn't a long time. And there was a lot of different projects that I wanted to work on. I had 100 days planned, and 100 days are over, and I haven't accomplished a lot of things that I intended to accomplish because COVID-19 basically took over everything that we were doing for a long time. And so there's a lot of different projects that I have yet to accomplish. However, I think that in the long run, we'll be able to accomplish those. Probably my primary goal when I became mayor was to work on addressing income inequality. There's a lot of people in the community that are doing okay, and then there's a lot of people in the community that are really struggling to get by. And there's many things that the city can do to help support individuals that are really struggling. And this crisis with COVID-19 is making those problems even worse, because many of the people that are out of a job because they can't telework, or because they're laid off because they're not in management positions, those sorts of things, we're already struggling a lot. And so it's really important now more than ever to make sure that the City Hall is working really proactively to try to address income inequality. After we start to get over this crisis, that work is becoming much, much more important. Thanks for your question. I have a question. Isabel, is that your name, or is that your another family member's name?
That's my name.
Okay.
I use Zoom a lot, so I have my own account. Yeah.
Awesome. Cool. Thanks. Okay, I'm going down the list here to Simon. You're on mute.
Sorry. I would say my biggest question is, what are the projected effects on city revenues and expenditures of coronavirus? And what's the city's plan to deal with increased deficits?
Yeah, this is a big challenge of ours. So in addition to community members having a lot of economic challenges, right? A lot of people have lost their jobs. The state released unemployment data yesterday that is by town. And New Haven's hit pretty hard. There were over 5,600 people in New Haven that applied for and received unemployment benefits from the state just since March 15. So that's a lot of people you think about that are really struggling. And also, City Hall has been hit pretty hard too. In particular, we haven't been able to collect the kind of revenues that we normally collect this time of year. And some of those revenues are taxes that people pay. We haven't been able to collect the taxes as much because we're not able to more proactively go after individuals that have not paid their taxes. And the additional revenue that we've lost is building permit revenue. So there's not as much construction going on, and the city gets a lot of money through building permits. And can you guess the third thing? We weren't collecting parking meter revenue and giving out parking tickets. And nobody likes parking tickets, but they're an important thing for the city because we want to make sure that people are following the rules, and also they provide some revenue from the city. And so those combined with a deficit from the New Haven Public Schools add up to $15 million in deficit that we're looking at for this fiscal year. And our fiscal year, which is the budget year the city uses, ends in June. So we have to find ways to make up that $15 million or dip into our fund balance, which is like our piggy bank. And we're working hard to identify ways to do that. Next year, I think it's likely that we'll get some of this money that's in this deficit back once we start to get a little bit back to normal. But we're also stopping most major expenses for the next several months to try to limit the amount of money that we're spending. And we're exploring other options to more proactively collect the tax revenue that hasn't been paid. Okay, let's go to Sahil. Simon, it looks like you have a follow-up question. We'll come back around and hit you again, all right? Go ahead, Sahil.
Okay. How does the coronavirus affect your job as mayor, and how much of your time is spent doing work related to the coronavirus versus what you had planned to do when you were running for office?
So I would say, this is a good question. I would say that over the past month and a half, 95% of my time has been spent on addressing issues around the coronavirus and COVID-19. And about 5% has been spent on other issues. And this is particularly important because we needed to act really quickly to prevent the kind of challenges to our health system that you saw in Italy and New York. I don't know if you guys have heard, but some other places had really catastrophic effects from COVID-19 because they didn't do social distancing as quickly. They didn't close down businesses and public schools as quickly. And so the virus spread so quickly that the hospitals weren't able to manage all of the patients. And so we were lucky that we were really proactive, but we had to work really hard nonstop for many, many days with my staff to make sure that we were shutting down businesses and closing schools and providing resources for some communities that were really vulnerable in the city, making sure that we were distributing food. It started to, the 95% is starting to go down a little bit of the time I need to spend on COVID-19. And I'm starting to turn more attention back to some of the other projects, just because our team has put into place a lot of systems to make sure that we're able to manage COVID-19. And also because the number of daily cases that are increased is starting to go down. So we're starting to get a little bit more of a handle on the virus, and that's allowed me to turn my attention to other important projects. Thanks for the question. Let's go to Chelsea. Chelsea Singh.
Hi.
Is that your name?
So yes.
Okay.
So my number one question is it has to do behind the whole economic part of things. So economic struggles and disparities have been really put in a very long time in places like New Haven. So I was wondering why it took such a tragedy behind the circumstances of the pandemic to actually address the issue behind things like these economic disparities with the solution of stimulus checks, an expansion of time to complete your taxes, and mortgage amnesty.
This is a great question, and I think that the answer is it should have happened years and years and years ago, right? And this is frankly, I think the reason for this is that there was so much pressure from all around the country from many different people that are Republicans and Democrats to get help, and that's what laid the political groundwork to open up the stimulus package. Like it all of a sudden didn't become political because everyone was having major financial problems. But I think to what you're getting at in your question is one of the keys to what our values should be. We should all as a society have been thinking much more many years ago about how to address the economic challenges of people, particularly communities of color in the nation that are really struggling. And unfortunately, the leadership in Washington has not been willing to do that. And it sadly took this crisis to start to do that. But I would say that the stimulus money isn't really fully addressing the problem that we're seeing. And a lot of the stimulus checks, and I don't know if you've seen the news, but a lot of the money coming from the federal government has gone to some larger businesses, hasn't gone to small businesses, hasn't gone to businesses run by undocumented residents. So there's a lot of people that are still forgotten by the money that's coming from the federal government. And I think there's a lot more work that we need to do on the advocacy side and on the leadership side to make sure that everyone gets the benefits and support and opportunity that they deserve.
That was actually going to be my follow-up question. I was going to ask, do you think that the $1,200 stimulus check was actually going to be enough?
Yeah, the answer is no. The answer is no. And I do think that it's also really important that we carefully but slowly open up the economy so that we can start to recreate those jobs, because eventually the federal money is going to slow down and we need to make sure that people get back to work. I think it's one of the roles that the government can play, and the city and the state, the federal government can play, is encouraging job training so that more people are able to get back to work, and people that previously didn't have those opportunities can get more opportunities to get back to work. Thanks for the question. So I have the Shima Ibrahim. There's another Shima Ibrahim, and I presume that's not your name either, is it?
Yeah, it's not. So, hello, I'm Omar Dwight, and my question is, how will you decrease the spread of COVID-19 among homeless people? And are there specific things you will do to prevent a new surge of infections in a second wave of COVID-19?
Thanks. These are really good questions. As I mentioned earlier, we've worked really hard to help support individuals experiencing homelessness. And one of the ways that I already mentioned is the Career High School project. Another way is that we, in partnership with the state, have provided rooms to over 200 individuals experiencing homelessness in hotels. And the reason for that is that previously many people were living in homeless shelters and they were pretty close together. People were pretty close together, and that doesn't allow people to practice social distancing. And so it's easier for people to spread the virus. And so by moving so many people into hotels, we can ensure that they're separate from each other and can live separate lives and not spread the virus. So that's been a big problem that project that the state and we have been working on that's been pretty successful. We also just started, I think a number of people here from East Rock School, we just started announcing a plan for next week where we're going to put up a outdoor tent and have a drop-in center for people that are experiencing homelessness in Blake Field, which is right behind East Rock School, where people can go and get services if they need them. And we can check and make sure that we check people's temperatures, and if people need to get tested for COVID-19, we can test them. We also give some medical support and mental health support and some food. So that's another way that we're helping support the homeless population. You had a second question. What was your second question again?
My second question was, are there specific things you will do to prevent a new surge of infections in a second wave of COVID-19?
That's a great question. I think we are thinking very much that we'll have to slowly open up and potentially be prepared to close up a little bit too if we see another infection. And I think that closing up again will be really hard for the community if we end up having to do that, because people are already getting, antsy. People have been inside for a long time, but also more importantly, a lot of people have been hit really hard economically and need jobs and need to get back to work. And so it'll be really hard for us to do that. What's critical is that we have a lot of ability to test people. And we also have what's called contact tracing. So in addition to testing people, after you test them, if they test positive, we'll have people, we already have 170 volunteers that are doing this, that will call that person and say, where have you been the last 14 days? And who have you interacted with? And then they'll call the people that person interacted with and say, you might have been exposed to COVID-19, so you should get tested too. And so if we do that really quickly, we can identify all the people that might have COVID-19 before they start spreading it to other people. And then those people can get tested. And if they're positive, they can be self-quarantined. And so we can get a handle very quickly on a potential outbreak before it gets bad. Let's go to, is it Johannes Rodriguez?
Yeah,
Did I pronounce it right?
Yeah, you did actually.
Awesome. And that's your name, right?
Yeah.
Okay.
So I have two questions. My first question is regarding EBT benefits. So recently, the governor talked about how the federal government has given money to states where they could provide inner city kids or inner city students, like New Haven Public School, to have access to EBT benefits. So will New Haven Public School students have access to those benefits, and when?
So this is a great question, and we're really happy. So in addition to what you're talking about, there's been an effort to allow people to use EBT and SNAP to purchase food online for delivery. And we have right now at many New Haven public schools, I think it's 37 or so, a food pickup for people that want to come and pick up free food through the free and reduced school lunch program. And so people can go Monday, Wednesday, and Friday to a school. There's a list on our website of all the schools on the City of New Haven COVID website, and pick up breakfast and lunch for multiple days each time they go. We're also doing a lot more distribution of food in a variety of different ways. But one of the things to what you pointed out, which is really important and we're excited about if we're able to make it happen, is ShopRite has a delivery service for food for residents that use SNAP and EBT. And they, ShopRite's issue, they currently deliver in other towns, but they don't deliver in New Haven, is they don't have enough vehicles to deliver the food. And so we're exploring the use of New Haven public school buses to help deliver food to people that order online that have SNAP or EBT. And what's cool is that the school buses currently aren't being used for much else, right? And so it's a good opportunity for us to use resources that we already have to get more support for the community. I think as you pointed out, there's a real challenge right now because a lot of people are struggling to get by and they need food, right? They not only are they struggling economically, but they need food. And we've got to think of lots of different creative ways to make sure they get that food. Let's go to Jacob Martin.
Hi, Mayor Elicker. Can you speak to the effectiveness of initiatives that have been working to ensure New Haven public school students have access to online learning spaces?
This is a great question. I think it's more of a question for you all, actually, because you all have been experiencing this firsthand. I know that I'll start, and then I'm actually curious, Jacob, if you have a response yourself. We have 20,000 public school students in New Haven. And all of a sudden, in like a week, we went from teaching in the classroom to everyone being at home and having to learn on the internet and with packets, right? There's a lot of packets that have been sent home. That's a really bad situation because for our teachers to that quickly adjust and our system to adjust is really difficult. And you add on top of that, that about 30% of the respondents to a survey that New Haven Public Schools put out said that they didn't have access to the internet. So 30% already don't have access to Wi-Fi. And then there's even more young people that don't have access to a device, a Chromebook or an iPad. So New Haven Public Schools has been really scrambling to try to get more access for students, both for the internet and also for devices. They gave out 8,000 devices, and there's about 5,700 more devices that they're getting from the state and Yale University. But that's still, when you think of 27 or 20,000 students, that's still not enough. So they're working to raise more money to buy more devices to make sure that more people have access. And so that's just to get people access. There's this whole other part of it that's like your teachers learning how to offer online education, right? Because that takes some training. Not everyone knows how to do that. And then there's another component where some kids maybe don't have as many caregivers at home that can help support them. And so that's a whole other challenge. I know that our partners at New Haven Public Schools are working really hard to address that problem, but it's going to take some time, and I think it's not going to be perfect. And it's a tough situation. I'm curious how you think it's going, Jacob.
Yeah, I mean, my transition to online learning has been pretty smooth. I would say I'm doing okay, and my friends are doing the same. But I'd be curious to hear how others are approaching this really crazy change.
Yeah, it is a crazy change, to say the least. So let's go around. Maybe some other folks can, with their questions, mentioned on how that's going. Can we go to James? James, your internet is struggling a little bit.
Are you? Can you hear me?
Kind of
This
not.
is not good. I don't know. Can you hear me?
Just a little bit. It's spotty.
Okay.
Maybe try typing your question in the chat,
I'll
James.
try again.
Hey, James, yeah, type your question in the chat and we'll go to Naomi for now and then we'll come back to you, okay?
Hello.
Hey, Naomi.
I have a few questions, but I'm going to start with summer programs. So what opportunities for summer employment for students do you think will be available?
So it's a good question, and we're still trying to figure this out. And I'll give you some examples of what we're brainstorming about. And what we're brainstorming about isn't necessarily what we're going to do. I want to make that really clear. We're not exactly sure right at this moment what the right decisions are, because we don't know. Just because we've started to see the number of new cases every day go down doesn't mean that we have things under control, right? And so we have to be really cautious about saying in 2 months, this is what things are going to look like. But what we're thinking about is it's going to be real tough for us to do full summer programming. We'd like to do summer school for some kids. We don't have full funding to do that, but we'd like to offer summer school to some kids like we usually do. We've got to figure out how to do that if we end up doing that in a way that allows students and teachers to do social distancing. So there's a lot of different ways that could look like. That could be online learning again, like you're doing right now, or that could be not as many students going into a classroom and having a classroom with one teacher and maybe 5 students or maybe 3 students, right? So it could look like that. That's not ideal, but we're trying to do as much as we can. With the programs that are offered through the Parks Department, one of the things we're brainstorming about, and again, we're not sure what we're doing, but one of the things we're brainstorming about is oftentimes with the Parks Department programs, we have like a lot of kids and 1 or 2 leaders, and they're doing games like all holding hands or, games that are really physically interactive. We're thinking, well, it's going to be hard for us to make sure that really young kids that are sometimes in these programs follow directions and practice social distancing. So we might not offer as many programs to young kids, as an example. But for older kids, we might do more hiking with smaller groups so that people can do social distancing. But at the same time, we're offering some programming, but it's not a ton of kids. So we're brainstorming on a lot of potential different options. We haven't made any decisions on what they will be. And so please don't go and say, this is what they're going to do, or that's what they're going to do. We're really not sure yet, but we're trying to brainstorm different ways that we can provide some opportunities for young people for the summer and do so in a safe way. Can we do, you said you had a number of questions. Can we do one more and then go to the next next person, because we've got a lot of people on our list here.
Sure. In regards to coming back to school, how do you plan to make sure that career students specifically don't get infected, because that is where the homeless people have been staying?
Yeah, I appreciate that. And so the site is in the gymnasium only, and the gymnasium has a whole separate air conditioning and heating system. And so that's something that's really important. And the CDC recommends different ways of cleaning that make sure that people are kept safe. I do think it's important also to highlight, because there's been a lot of talk about career, that there are 1,600 people in our community that have COVID-19. There's probably a lot more, right? And there's been a lot of attention on career, and it's in a school, but there's been other people that have been in the schools, right? Because there's so many people that have had COVID-19. There's been people in workplaces. And I think it's really important that we don't single out that one site because there are so many different houses and buildings all around the community that have also had people in them that have had COVID-19. We'll be making sure that in many places people are kept safe, but also the virus, a lot of research has been done on the virus, and it doesn't appear to last for a really long time in a location. We'll make sure that kids are safe and the staff is safe when they go back to the school, just like we would in other places where individuals might have been positive for COVID-19 and be in a space. So
Thank
let's
you.
go to Sydney Johnson.
Hi.
Hey, how are you?
Faded out for a little bit. I had some technical difficulties. My question is that as quarantine seems to like be prolonged into the summertime, what measures are you putting in place to keep people safe if they feel the need to leave their houses because of maybe lack of air conditioning if it's really hot in the summer?
So that's a good question. It is safe to leave your house even now, as long as you're staying more than 6 feet away from someone else, as long as you're wearing a mask, as long as you're washing your hands after you touch things. What's important is that not that you have to stay at home all the time, but what's important is that you don't interact with a lot of other people. When you think about it, this is like, you think about how you protect yourself from getting germs and getting a cold. You do so by making sure that you're not coughing on other people and other people are not coughing on you, that you don't touch things that other people might have touched and then touch your face so that your germs can get in your mouth or your eyes, things like that. And so my concern is not that people will go outside. My concern is that people will go outside and so many of people will go to certain places and not be paying attention to practicing social distancing. So for example, if a lot of people go to Lighthouse Point, like a lot of people, that's okay if they're all away from each other and there's a lot of space there. But if people start to get really close to each other and they start to play basketball and they're all touching the same basketball, say, or in basketball there can be some kind of contact, those sorts of things. If those sorts of things happen, then we have a real problem. So what we've talked about doing in City Hall is really educating people and continuing to remind people, you got to wear your mask when you go outside, you got to wear your face covering. You got to make sure that you're 6 feet away from other people so that you help prevent the spread of the virus. James, you wrote your question. Let me see here. Thank you, Mayor Elicker. I'm sorry about the inconvenience. No problem. I know that you and your staff at the Mayor's office work extensively with the New Haven Board of Education and New Haven Public Schools to ensure that New Haven students are safe. How will the New Haven Public School District support schools' distance learning plans in the event that a second wave of infection arises during students' return to school in this fall? This is a great question. And I think that it's related to some other questions that have come up in Jacob's question about how we feel things are going now. The nice thing about if we end up if there's a resurgence of the virus in the fall, it's probably more likely that there'd be a resurgence of the virus in the winter, because that's when typically viruses are more contagious. But if that happens and we have to close schools again, what will we do? The nice thing is we're working hard now to learn better how to do online learning. We're working hard now to get more devices for young people. We're working hard now to get more Wi-Fi in the neighborhoods and figure out a plan to do that, so that those hurdles will hopefully be overcome by the time September and the fall and the winter come around. Also, our teachers will have had a lot of practice in doing online learning. I think that online learning is not a good substitute for in-person learning. And it's important for us to, as much as we can, make sure that there's in-person learning. but at least we'll have had a lot of practice over the next couple months and a lot of time over the summer to prepare if we do end up needing to close schools again in the fall, so that more young people can have access to online learning. Okay, so I think I cycled through everyone once. Can you physically raise your hand if you have another question? Okay, so let's go to Eleanor.
How do you think schools will look when they reopen? Will students need to wear masks? What changes do you expect?
So the question is, how do I think schools will look when they reopen? Will students need to wear masks? What changes should we expect? I think this is a great question. And I think that students will need to wear masks. I think that teachers will need to wear masks. As you guys know, it's going to be hard to get really young students to wear masks. Like, I have a 5-year-old and a 1.5-year-old. The 5-year-old's pretty good at wearing masks, actually, but the 1.5-year-old, not good at wearing masks. Lucky that we don't have any 1.5-year-olds in our schools, but we have some 3 and 4-year-olds, and that'll be tough, right? But I think that there's likely going to be a lot more practice of washing hands and keeping your hygiene up. There will be mask wearing, and as far as other changes, I think it's hard for us to know right now what exactly that's going to look like. Most schools, or most of the school days, indoors, right? And when you're indoors, it's easier for the virus to spread because you're kind of in a contained area where all the air circulates in one area versus outdoors. And what I think is likely to happen as we open up is we'll start to open up things outdoors. Like, say, restaurants, for example. We might have more outdoor seating in restaurants so that not as many people are as exposed, but we can't do that with schools. And so I think it's going to be really challenging for us to figure out ways to make sure that we're keeping kids safe and teachers safe when we open up the schools. All right, I saw Isabel had another question.
Yeah, and so we all know that, like, obviously the times are moving on. There are seniors that wanted to graduate this year. I understand that obviously our health comes first and everything, but especially for the class of 2020, I was wondering if they would like be able to make up any of the experiences they lost, like prom, graduation, anything like that they could have missed out on. Is there any way that they could make up for it, or no?
Good question. I actually do not know the answer to that, but I'm happy to check into it and ask Dr. Tracy, who's a superintendent of schools, because I bet they've thought some about this. It is it's a real shame that senior year for a lot of kids is such an important part of their life, and to miss things like prom and graduation is a real shame. So let's go to Shima Ibrahim and then to Simon.
Yeah, so my second question was, how are you planning to bring back New Haven from the COVID-19 situation, and what are the 3 most important issues you need to consider?
Good question. How do we plan to bring back New Haven? This is a hard question because it's likely that we're going to have to live with COVID-19 for a long time, maybe even more than a year, until they find a vaccine that everyone can get so that people don't catch COVID-19 anymore. And so because of that, the important things are balancing health, which you said, what are your priorities? Health is the top priority. We need to keep people healthy, right? And the economy, which is the second priority. And we want to make sure that we're keeping people safe with testing, with contact tracing, like I talked about before, while slowly opening up the economy so that people can start to get jobs again. Because if we open up too quickly and all of a sudden everyone can go back to school and everyone can go to any restaurant they want to, then we're going to have a real problem where a lot of people will catch the virus again, and then we'll have to close down. And so we don't want to do that because of the impact on the economy and the health. So we just got to be really careful and balance health and the economy. Okay, go for it, Simon.
I was wondering, so English Drive by East Rock was closed recently. Are there any plans to close any other streets in the city?
Good question. So this was our trial balloon, if you will. This is our test. East Rock we closed English Drive and Farnham Drive a few days ago because the trails are pretty narrow in East Rock Park, and we had a lot of people reaching out and saying, hey, other cities are closing down some streets so that people can walk in the street and be 6 feet away from each other. Can you do this in New Haven? So we're testing it out. We've so far got a lot of really positive responses. I'm very open to exploring closing down other streets in the city. If there are residents that are really calling for that in different spots in the city, and our board of alders are on board and we work collaboratively with them, I'm very happy to do more of that because it seems like something that residents are really excited about. Sahu, you had another question.
Yeah. Okay. What is the most interesting thing you've learned as mayor while dealing with the coronavirus?
What is the most interesting thing that I've learned as mayor while dealing with the coronavirus? Good question. I think that this crisis has shown me even more just how caring people are. When you think about all of these healthcare workers that are in the hospital, putting themselves at risk of getting the virus, but going to work every day because there are people that need their help. When you think about our police officers and our firefighters that are responding to so many calls throughout the city and putting themselves at risk because in many cases they're responding to calls that are people that are sick that may have COVID-19. When you think about people working in nursing homes or people that are working in funeral homes, and these are all really hard jobs in normal times, but they're much harder jobs when people are afraid for their own health. And that's made me realize even more just how much how I admire so many people in our community for stepping up and being selfless and caring for thousands of other people, even when they're at risk themselves. And that's really inspiring. So other questions, I see Johannes Rodriguez again, and then we'll go to Chelsea.
Hi, this is my last question before I have to get off this chat and go to a class. So
I have to get off pretty soon too.
yeah. So my last question is, what are your motivating words to students and especially class of 2020 who are going through this situation right now?
I think so. What are my motivating words for students in the class, and especially the class of 2020? I think these are really hard times for everyone, and I've been calling family members of people who have passed away from COVID-19, and there are so many people in our community that are really struggling right now. This is something that this pandemic is something that none of us ever expected to happen. It's something that hasn't happened for many, many, many decades. And for so many people in our community, this will have an impact that we will remember for decades. And so I think it's really important for everyone to understand that, and especially our young people, first of all, how grateful adults like myself are for the work that you're doing to practice social distancing, to do your best to try to do online learning, which isn't the same as having the teacher in the same room and your classmates in the same room and your friends in the same room, to make sure that as much as you can, you're supporting your family and your neighbors at this time. This time will end, right? And we will get back to some normal lifestyle in the future. It's going to take some time to get there, but if we don't all cooperate and work together, if we don't practice social distancing, the time will go on for much longer. And so it's really important that we work as a community, even though it's hard. And it's important for you to know that there's so many people in our community and adults in our community that want to support you and get through this together.
Thank you.
Thank you. So let's do 2 more questions. We can go to Chelsea.
All right. So my second question was about the different statistics on death. So I've heard that when a citizens die, regardless of what the casualty may be, that they're tested for corona, and if it comes out positive, they're listed like in the statistics that are displayed to the public as someone who's died of corona. And I'm just wondering, like, is that true? And if so, like, why is that?
It's not, so it's not entirely true. And this is actually one of the problems with the information that's coming out about COVID-19. So there's actually, there's been some articles that have come out in the last couple days where the number of deaths that have happened in this last month and a half are much larger than the number of deaths that happened in previous years at this time of year, and even larger than the number of COVID deaths. So if you understand kind of the thinking there, what's the potential is that actually the number of people that have died because of some reason related to COVID might be much larger than actually the number of deaths that we're reporting every day. And that's because there may be people that died of a stroke, but the stroke might have been COVID might have contributed to that. Someone died of heart disease or someone died of some other condition, but COVID might have contributed to that, and they might not have died if they had not gotten COVID as well. And so one of the whole problems with this virus is that all along we haven't had good data on exactly what's going on. We've gotten better over time because there's been more systems put in place to track people. And the data is really important to figure out who's being impacted and who's not being impacted. The data is one of the things that led us as a city to say we need testing sites on Dixwell Avenue. We need a testing site in the Dwight neighborhood. We need a testing site on Grand Avenue because those are hot spots where we're getting a lot of COVID cases. And so we need to identify more people and support the community. And so that information is really important, and it's not perfect yet. And I think that we're all trying to work to make sure that we get better data. So let's do last question is to James. Do you want to see if your internet works again? It's looking kind of spotty again. We'll see. Kind of.
Can you hear me?
Yeah, go for it. Quick.
Okay.
Quick while it's good.
My question to you was, what is your opinion on how of the impact of social distancing in the coronavirus in New Haven? Yeah.
So I think what you asked is, what is your opinion on how the social distancing worked in New Haven? Is that right?
Can you hear me?
Oh, it says, thank you for your, as a follow-up question, how well do you think social distancing is being maintained in New Haven? Got it.
I put it in the chat, how social distancing.
Yeah, I see it. Overall, it's going really well. It took us some time. And I think it took everyone in New Haven some time to get used to it and start to actually really understand what it means, because it was a whole new word for us, right? 2 words for us, right? If I had said social distancing a year ago, you would have looked at me like, what? What does that mean? But now we've used it so many times and talked a lot about what it means that people are really starting to understand it, which is important. There are examples around the city where people are still not practicing social distancing. And just in one example, yesterday I saw a group of kids that were on bicycles that were outside City Hall and doing tricks on their bicycles, not dirt bikes, but just like normal small bicycles. And they were all really close together, and they were high school kids. I think it's really important, in particular for young people, because you guys have seen the data that generally young people don't get really, really sick from COVID-19. That doesn't mean that you shouldn't abide by these rules. And the reason why you still really need to abide by these rules is if you get it, then you might pass it to your family member who might be older and might really, really get sick. Or you might pass it to your family member and they might pass it to someone that's much older and they might even die from it. And so everyone needs to abide by these rules. I'm very proud that so many New Haven residents have been following these directions. And it's not just social distancing, it's wearing your mask. You got to wear your mask because you're protecting other people by wearing your mask. But there still are some people that aren't abiding by it. So we got to make sure that we're encouraging all of our friends and family to abide by it. So I said last question, but then someone new joined us. So I'll give Katie the last question. You're late, Katie.
I'm sorry, there was some confusion with the emails.
That's all right. That's all right. No worries.
So first, I would like to say thank you for all that you've done for the community about the coronavirus. Also, my name is Grayson Burns.
Oh, okay. Sorry. Katie's
yeah.
some other person.
Yeah, that's my mom.
Gotcha.
But I was wondering, is there anything as teenagers and kids that we can do to help the community?
This is a really good question. I think the first thing is follow a lot of the guidance that I just talked about and get your friends to do it too. And get your family members to do it too, right? I know even from having a 5-year-old that my 5-year-old has a lot of influence over me and can convince me to do things. So encourage your friends and family to do the social distancing, wearing a mask as much as you can. Encourage people to do that. Actually, I've seen some really cool masks that people have made, so that's been kind of fun to see what kind of creative solutions people are coming up with wearing masks. I think doing your best in school is, I know it sounds like a dad thing to say, but it's so important because right now, for your teachers to interact with you, it's hard for them to have the kind of interaction that they're used to. And you can be role models and doing a really good job in school so that once we get back physically into school, you guys can hit the ground running. And I know it's a lot to ask because there's a lot of pressure on you all, but there's a lot of pressure on our families too, right? I mean, there's people that are out of jobs. There's family members that are trying to do their best to support you all when they may have other issues in their lives as well. And so as much as you can, supporting your family members when they're struggling is something that can really help out. So that would be my advice to you. So thank you guys for all of your really well thought out questions and for participating. I'm hoping we can do this down the road again sometime. I have always given my cell phone out everywhere I go, and I gave it out at one school, Morrow Sheridan, and about an hour later, I got maybe 20 calls from kids. So I'm going to give my cell phone out again, but please do not all call me at once to test it out. Only use it if you have a legitimate question or concern, okay? Does everyone promise? It's 203-500-2969. You can text me as well. Just don't text me past or call me past 11 p.m., okay? All right, thanks everyone. We'll see you guys soon, and keep up the good work out there.
Bye.
Bye.
Thank you.
Thank you.
Bye. Thank you.
Thank you. Have a good day.
Thank you, Justin.
Bye. Thank you.